And joining me in the studio from OSF, we do have President Lisa DeKezel. Good morning, Lisa.
Good morning, Vanessa.
How are you?
I'm doing very well, thank you.
Good. I hope you're going to have a wonderful Easter weekend.
Oh, we will. In spite of the rain, we will have a wonderful Easter weekend. I hope you do as well.
Thank you. Also with us is Community Health Program Manager Emily Brooks. Hi, Emily.
Hey, Vanessa.
Good to see you in a different role.
I know. It's kind of weird.
Are you excited?
I am. I'm very excited.
Yeah, your job at the local YMCA really prepared you for this position at the hospital.
Oh, yeah. And I'm really loving it. It's so wonderful to work for OSF.
Good. Well, let's start with Lisa, the president of OSF Holy Family in St. Mary's. Really been an impressive couple of years for OSF in terms of growth and personnel joining the team. Catch us up.
Yeah, thanks so much, Vanessa. It really has been quite an exciting few years, a journey here with OSF in the Monmouth and Galesburg region. We continue to grow and thrive, and really have put a tremendous focus around establishing this regional model of care to really fully live into our capacity across Monmouth and Galesburg. So when we think about that, it's been not only recruitment of providers and specialists to help provide those services for our community, but even, increasing our capacity, let's say at Holy Family. So proud of that team there. We're keeping more patients local, whether that's for inpatient acute care needs. We've really tripled our inpatient we call it our inpatient census. So that's the number of patients that we're caring for on our inpatient unit and skilled unit there. Really have increased our outpatient surgery volumes. We've tripled those, and just have had a lot more specialists coming over to care for our patients here locally. And that's really been done in tandem, working just really hand in hand with St. Mary's and Galesburg, as we've continued to recruit in specialty there and really establish ourselves as an intermediate level complexity hub for this greater Galesburg region. But Monmouth Holy Family plays such a crucial part in that, and really leaning into keeping patients here locally and caring for them, and then opening up that capacity for those more complex needs in Galesburg. So it's teamwork. It's one leadership team stretched across the region with that vision, and just really, but more than anything, it's our frontline mission partners that make it happen every day, and they're just truly incredible. So we continue to add to our team to support that work, and just couldn't be more proud of them.
Okay, let's talk about the new providers for a moment. You've been talking about those that are joining, and we're going to have some of them on the air coming up. We've had one, Dr. Dionisio, and she'll be back on. She's accepting new patients. But tell us about those new providers who've joined the team recently.
Yeah, I sure can. So we're super excited to welcome Dr. Mark Meeker. He is our new Vice President Chief Medical Officer for the Greater Galesburg region, we refer to it as. So that does cover Monmouth and Galesburg, as well as Kewanee here as well now. And Dr. Meeker is well known. He has been serving in this area for about 34 years now. He's an internal medicine physician out of Galesburg, and knows this community very well, and recently made the decision to, he was serving as a physician leader in Peoria, also still practicing in Galesburg, and made the decision to, the call to arms to come home and serve as our physician leader here in this region. And he's just been a tremendous add to our team, our leadership team, and excited about that work with him ahead.
Okay, who are the other new providers?
Sure, we have Dr. Matt Heber. He is one of our new general surgeons, so he has joined our team of 4 general surgeons that are serving the region. Dr. Heber has been a great addition to the team as well. He was locally born and raised in Kewanee, Illinois, and so he is, from the area, and has been a great addition to our team of general surgeons. We have a 5th general surgeon joining us later this summer, Dr. Brody Stewart. Also, he and his wife are locals as well, and so it's wonderful to see them coming home to serve in their local communities. So really, we'll have a team of 5 general surgeons in the region to serve here in the near future. So very excited about that. And then Dr. Hamdani has also joined us. He is full-time gastrointestinal physician, so GI, and he is based out of Galesburg, but is accepting patients in Galesburg and doing a tremendous job, and quite busy serving the needs for our patients for GI services in the region as well.
Okay. And Dr. Dionisio, tell us about her.
Yeah, she's she's our newest family medicine physician here, and she is based out of the Rural Health Clinic here at OSF Holy Family here in Monmouth. Dr. Dionisio is truly genuine. She has a heart for serving her patients, really is a relationship builder, but also just really an excellent physician who has joined our team this year and lives here in the community. And so you'll get a chance to visit more with her next week, but she's been a great add with Dr. Bashir, Dr. Carrier as our physicians in the clinic, and our tremendous team of nurse practitioners. So we continue to grow that team there at our local Holy Family Clinic to serve the needs of our community.
Okay. We're talking with Lisa DeKezel. She is the president with OSF Holy Family and St. Mary's Medical Center. I should just call it the Greater Galesburg region.
The Greater Galesburg region,
Meet the branding. Lisa, tell me a little bit real quick about Roseville for our southern listeners in our southern part of the county.
Yeah, I do want to make sure, we are really committed. One of the things I love most about OSF is its commitment to serving the rural communities. And so we continue to have, our rural health clinic in Roseville that is there and positioned long-term to serve the patients in that community. That team works very closely with our Monmouth Rural Health Clinic team, tied very closely to our physicians and providers there, our leaders and support staff. So we continue to serve in communities such as Roseville, Abingdon, and many other outlying rural communities, and that's a commitment that we intend to sustain long term.
Okay. Thank you for that update. Another quick update. Remind us about the on-call and urgent care, those services and where those are located.
Sure.
I saw a new one. I shouldn't say new, but I was in Peoria 2 days ago, and I saw a very nice new center over there.
Yes.
OSF On-Call Urgent Center, I think it said. So
On-Call Urgent Care, yes.
On-Call Urgent Care.
Yes.
Okay, tell us about that.
Yeah, so our On-Call Urgent Cares really is a model. It really has those traditional urgent care services as far as you can walk in, be seen for those acute illnesses, really that don't require you to go to the emergency room, and maybe due to your schedule to try to schedule an appointment with your primary care provider, you just need that quick drop-in, right? So they can serve your urgent care needs there. They have imaging, so they have x-ray available as well in those on-call urgent cares. The neat thing about on-call is you can also get in the waiting room online. So you can actually jump on, kind of get in line in the waiting room, I guess I would call it. And then when you arrive, you let them know you've arrived and you're already registered, you're already ready to head back. And so it's got a pretty quick throughput to get through that process. And that is located by the Walmart in Galesburg, in that strip mall there. So we have our on-call urgent care there. And then we also, of course, have our traditional prompt care services, which are located at our Center for Health campus in Galesburg, which is the former Cottage Hospital campus that we now have stood up as our Center for Health campus. And so we have our prompt care services located there as well. So we have services available to you 7 days a week, 365 days a year. They're also positioned and opened on holidays, and so we're there for you when you need us.
Okay. Remind us about the number of beds and inpatient rooms. You've really been working on the Monmouth area, too, of having more patients. Tell us a little bit about that.
Yeah, I really love this work. So we, traditionally here at Holy Family, we have our inpatient beds. So that's patients that require an acute care stay. So you come in, you need to stay with us for medical attention on our inpatient unit and be admitted there. Traditionally, that we are a licensed 23-bed hospital at Holy Family. Historically, we've had volumes of maybe 3 to 5 patients a day on that unit. We now are preparing to staff for up to 16. We've seen tremendous growth. We've had incredible commitment by our teams to really lean into keeping more patients local. We have a robust hospitalist physician service, and it's boots on the ground. It's a local team that's there on site to care for patients, our physicians, and just an incredible nursing and ancillary support teams that are there to really keep more patients local. We also are working on expanding our cardiac telemetry services there, which will allow us to have the cardiac monitoring for patients who are and we have cardiology that does rotate over to Holy Family. as well. And so as we continue to grow and expand our specialty services across Galesburg and Monmouth, across the region, we're looking at trainings and competencies, specialty coverage, physician coverage, nursing growth, increasing staffing to keep more patients local and care for you here in your community, close to your family. And that's really important to us, and that's how we sustain rural health care long term, and that's exactly what we're doing at Holy Family.
And the very important aspect of that people may not think about is the transportation issues. That's why it's really key and vital.
It is. It really is. When we look at our community health needs assessment, and that's really where we survey our communities and to understand what are your barriers to health care, what are those components that are impacting the wellness of our community. Transportation by far surfaces to the top. You think about food insecurity, you think about financial strain, but then transportation always surfaces. And we really do have a gap in transportation services within the community. However, our team is working very closely with Warren County, working with the Galesburg Transit, really trying to connect services for patients to make sure patients have access to health care. And so part of that strategy also is to really lean into being able to keep more patients local, like you've just stated, Vanessa, by increasing our bed count, by increasing our staffing, our physician coverage, to keep patients here in local beds so that families aren't having to travel long distances, caregivers to help with their loved ones who are potentially admitted in the hospital, requiring services. So the more we can retain and keep local, absolutely the better for our patients and their families and caregivers, and that is absolutely our commitment.
Okay. Emily, you've got a big deal coming up with OSF, one of your first big events.
Yes.
Tell us about it.
So we are hosting a mental health fair in Knox County at the Knox County YMCA. When I brought it to Erica, who is their membership director there, she was like, absolutely, we would love to be part of this and help you host it. So we are putting that together in honor of Mental Health Awareness Month, which is all of May. And we're going to have all kinds of community partners part of this event. We'll have Cornucopia there, Turning Point Child Advocacy Center, Bridgeway, all different kinds of community partners are going to be there to talk about the resources and handouts, all kinds of things that we have in our area to help you with your overall mental health and your well-being. So we're really excited to put on this event. It's free. So anybody that's out and about that want to bring their family and kids, please do. There's going to be activities there. We're working on getting our therapy dogs there as well. There's going to be all kinds of great things for the whole family to come out and just be together, interact, and learn and educate about what we are doing in the Knox community to help your overall mental health and your well-being.
Okay. So we're going to have resources, community engagement, stress management activities, snacks, possibly therapy dogs.
Yeah.
Where's it at?
So it's in the McBride gym at the Knox County YMCA. So not their main gym. They have another gym offside of it. So it'll be in their smaller gym. But we'll be in there from 9 a.m. to 12 p.m. And we'll also have all kinds of prizes and raffles to give out as well. So definitely come out because we're going to have all kinds of goodies and a really nice cooler that Lincoln Behavioral Health donated to us to raffle off to somebody.
Okay. Anything else you're working on?
Not at this moment. I'm just learning and growing as I am transitioning into this new role, but just doing everything I can to continue to serve our communities.
You're going to do great, Emily. I know you will.
Thank you.
I know you will. And Lisa, finally, let's talk about hiring because you're a major employer in this region.
Yes, we certainly are. And we're proud to support our community and our economic development in that way as well. And so we absolutely are hiring for all sorts of positions, of course, across Monmouth and Galesburg. And if you go to OSF Careers on our website, you certainly can see the different postings available. But, whether it's clinical, meaning nursing, lab, imaging, but also, of course, so important, housekeeping and dietary. I mean, it takes all of us. And I always tell our mission partners, we need each and every one of you all in every day to make it happen. And that's what makes the magic happen across the region. And so we're really blessed with incredible mission partners. We refer to our employees as mission partners because we're all partners in the OSF mission. And but we are hiring and have positions available. So if you'd like to be a part of a mission-oriented team here locally to serve your community, we would love to meet you and talk with you about the opportunities available.
Wonderful. And in addition to that, you've got a new Center for Outpatient Services. That design work continues.
Yes.
And that's for Monmouth, right?
That is absolutely for Holy Family here in Monmouth. We are deep into design of our new Center for Outpatient Services project, and that is really going to bring increased parking. A brand new main entrance for OSF Holy Family will be very similar to what you've seen with our new emergency department entrance, kind of that same aesthetic, but most importantly to welcome our community into the building. It will also relocate, very importantly, our laboratory. Our lab is growing by leaps and bounds and very busy, and it's outgrown its space. And so brand new lab will be a part of that as well. And then really just bringing all of those outpatient services, so lab, imaging, cardiopulmonary, all of that kind of together in kind of a hub there in the building. So when you come in to register, the services will be close, no more the walks down the long halls to the different departments. We're going to bring everybody closer together and make it easier to access for our patients. And we want to welcome you in and serve the needs of our community. So that's a very exciting project, and it will be the latest and greatest, in our master planning to really maintain Holy Family as the healthcare hub for this community. So we're very excited about that.
Okay, a lot of great things.
Yeah.
A lot of great things happening.
Oh,
so
yeah.
This is good. And remind people one more time, Emily, if they just tuned in, where your Knox County Mental Health Fair is at.
Yep, it is Saturday, May 10th from 9 a.m. to 12 p.m. at the Knox County YMCA in the McBride Gym.
Wonderful. Ladies, thank you for such a great update.
Yeah, thank you for having us.
Thank you for having us.
Have
Thank
a
you so
wonderful
much.
weekend.
You as
too.
well. Happy Easter.
Happy Easter. Emily Brooks with us. She's the Community Health Program Manager. And Lisa DeKezel is the President with OSF Holy Family and St. Mary's.